often say that growing older brings wisdom, understanding, and a certain elegance. However, they often leave out the fact that aging also brings adjustments, particularly to areas of your body you might hesitate to discuss, even with your closest confidants. I'm Dr. Harold Grant, and if you're a man over the age of 60, I want to speak directly to you. Not in the manner of a doctor lecturing in a clinic, but as someone who has spent decades listening to men just like you. Men who once felt strong and complete, but now quietly wonder if their bodies are simply changing with age when they no longer respond as they once did. Let me be perfectly clear from the outset. Your penis is not immune to the aging process. It ages just like your heart, your brain, your bones. And yes, if it's neglected, it can begin to fail in ways that take away more than just its function. It diminishes your self-assurance, your dignity, your sense of masculinity. But here's what most men don't understand and what many doctors don't bother to explain. It's not age that erodes sexual health. It's inattention. And the truth is, it doesn't have to be like this. What if I told you that the primary reason for penile dysfunction in older men has nothing to do with testosterone levels or even circulation? What if the most effective remedy isn't another pill, but 5 simple daily practices you can begin today? Practices based on scientific principles, not just supplements. Practices that not only support your physical well-being, but also restore your sense of self. In this video, I'm going to guide you through 5 vital strategies for caring for your penis as you get older. Practical, proven, and deeply personal steps that go beyond just performance to preserve what matters most: your vitality, your self-respect, and your connection to yourself and others. And if you stay with me until the end, I'll share one extra habit, something that most doctors completely overlook, that could protect you from one of the most painful and preventable penile conditions we see in older men. Before we continue, please do this for yourself. Click subscribe and enable notifications so you never miss another genuine, respectful, and research-backed conversation about men's health. And if this topic already resonates with you, type 1 in the comments. If you're doubtful, type 0, because whether you agree, disagree, or just need more clarification, this is a safe space for open dialogue. Let's start together. 1. Remain sexually active, even without intercourse. Let's begin with one of the most misunderstood truths about male aging. If you don't use it, you'll lose it. It's not just a saying. It's a biological reality. Over the years, I've sat down with men in their 60s, 70s, and even 80s. Men who once lived full, confident lives, now quietly expressing their concerns with lowered eyes. Not because they've lost their desire, not because they've stopped caring, but because society has told them that aging means giving up their sexuality. And too many have accepted it. Here's what I tell them. Sexuality doesn't end with age. It simply transforms. Your penis is more than just a part of your anatomy. It's living tissue. It thrives on movement, blood flow, and stimulation. Without regular activity, whether through intercourse, self-pleasure, or even medically assisted stimulation, the erectile tissue begins to weaken, blood vessels narrow, elasticity decreases, and eventually, the tissue itself can shrink. We call this penile disuse atrophy, and it is a real condition. But here's the good news. It's also completely avoidable. Just as your muscles need stretching to prevent stiffness, your penis needs activity to remain healthy. And no, this doesn't mean you have to have frequent intercourse. For many older men, physical limitations, medical issues, or the absence of a partner can make traditional sex difficult. That doesn't mean you're finished. Far from it. You have options. And your body will be grateful for using them. Masturbation, for example, is more than just about pleasure. It's a vital maintenance practice. It encourages healthy blood flow. It keeps the nerve pathways active, and it supports the hormonal and psychological feedback loops that maintain function and arousal. If that's not possible or comfortable, consider using a medically approved vacuum erection device. These devices are not just gimmicks. They're tools supported by science, designed to gently encourage circulation and maintain the elasticity of the penile tissue. You can also incorporate pelvic floor exercises, like Kegels, into your routine. These aren't just for women. For men, strengthening the pelvic floor supports erections, improves bladder control, and enhances overall sensation. The goal isn't to become the man you were at 25. The goal is to honor the man you are now with wisdom, intention, and care. I once treated a gentleman, let's call him Mr. S., who came to me at age 74 after almost a decade of sexual inactivity. He wasn't in pain, he wasn't sick, but he felt invisible. In his words, "I don't feel like a man anymore." After just a few months of intentional self-care, gentle stimulation, pelvic floor exercises, and a shift in his mindset about his worth, he returned to my office with tears in his eyes. Not because everything had returned to the way it was, but because he had reclaimed something even more important, his dignity. Remember, staying sexually active is about more than just function. It's about identity. It's about maintaining the relationship you have with your body, no matter how it changes. And if there's one thing I want you to remember from this section, it's this: you are not broken. You are alive, and your body is still listening. Give it the care it deserves, and it will respond. 2. Maintain proper hygiene. Now, let's talk about something that most men think they've already mastered, but very few are actually doing correctly, especially after the age of 60, hygiene. I know it seems basic, perhaps even a little awkward to hear from your doctor, but in my 30-plus years as a urologist, I've seen firsthand that proper hygiene is one of the most neglected aspects of men's health. Yet, it's one of the simplest ways to prevent infections, irritation, and even cancer. Here's what happens. As men age, their skin becomes thinner. It loses some of its natural protective oils. The immune system becomes less efficient. What your body used to handle easily, like a little extra sweat or bacteria, is now more likely to cause inflammation, odor, and painful skin problems if not properly managed. And if you're uncircumcised, the need for proper hygiene is even greater. Let's be honest here. Under the foreskin, smegma, a combination of dead skin cells, oils, and moisture, can accumulate over time. This isn't about being unclean. It's about biology. And if you don't clean it regularly and gently, that buildup becomes a breeding ground for bacteria, fungus, and chronic irritation. Conditions like balanitis, a painful inflammation of the head of the penis, or even phimosis, where the foreskin becomes too tight to retract, are far more common in older men than you might imagine. And here's the part that no one tells you. Chronic infections and poor penile hygiene can increase your risk of penile cancer. Let me say that again. Poor hygiene can raise your risk for penile cancer. In countries like Brazil and parts of Africa and Asia, where hygiene education is limited, this type of cancer is alarmingly common in older men. And while it's rare in the US and Europe, when it does occur, it's devastating. But the good news is, all of this is preventable. Here's how to take care of yourself properly and respectfully. Use warm water and a mild, unscented soap. Avoid the fancy soaps or deodorant body washes. They often contain harsh chemicals that disrupt your skin's natural balance. If you're uncircumcised, gently retract the foreskin and wash underneath it daily. Don't force it, just ease it back, rinse, and dry. Always dry thoroughly. Moisture trapped under the foreskin or in the folds can encourage bacterial growth. A soft towel is fine. Just pat, don't rub. Clean after sex or masturbation. Bodily fluids, lubricants, and sweat can disrupt your body's natural balance. A quick rinse goes a long way in protecting your health. Now, let's talk about something deeper. Because this isn't just about physical hygiene, it's about emotional dignity. When a man feels clean, respected, and in control of his body, it shows. He stands taller. He interacts more confidently with his partner. He's not afraid of intimacy. He's prepared for it. I once had a patient in his late 60s who had quietly suffered from recurring infections. He'd stopped pursuing relationships altogether. I feel embarrassed, he admitted, like I'm not whole. After I taught him proper hygiene, gently and without judgment, he came back 3 months later and said, "Dr. Grant, I feel like myself again." Never underestimate the power of something as simple as washing correctly. You brush your teeth. You trim your nails. You take pride in your appearance. Your penis deserves the same care. You're not too old. You're not beyond help. You're not invisible. You're a man whose body is still worthy of respect, attention, and daily care. So from now on, treat hygiene not as a chore, but as a ritual of self-respect, because when you do, everything else, confidence, intimacy, performance, begins to follow. 3. Avoid sexual activity with a semi-erect penis. Now, we're going to discuss something that most men never learn until it's already caused lasting damage: attempting to have sex before you're fully erect. It sounds harmless, perhaps even insignificant, but it's one of the most common causes of silent trauma I see in older men's sexual health. And the effects don't just impact your performance, they change how you feel about yourself as a man. Here's what you need to understand. Your penis is more than just skin and muscle. It's a highly sensitive and complex structure composed of spongy tissue, blood vessels, nerves, and connective layers, all working together to create a healthy, pain-free erection. When it's not fully engorged, when the tissue is only partially filled with blood, it's vulnerable. Attempting penetration in that state is like trying to force water through a garden hose that's partially kinked. It doesn't work as intended. And what's worse, it causes strain and internal tears, which we call microtrauma. Now, here's where it gets serious. Repeated microtrauma over time, especially in older men, can lead to the development of Peyronie's disease. This is a condition where scar tissue builds up inside the penis. That scar tissue pulls on the surrounding tissue, causing curvature, pain, and in more severe cases, erectile dysfunction. It's not rare. It's not just bad luck, and it's not always sudden. Many men develop it slowly over months or years and don't say a word because they're embarrassed or think it's just a normal part of aging. Let me be clear, it's preventable. Here's how. Never rush intimacy. Give your body time to respond. Engage in foreplay. Breathe. Let arousal build naturally. A fully rigid penis is not only more pleasurable, it's also structurally protected. Use lubrication. As we age, natural lubrication may decrease for both partners. Using a high-quality, body-safe lubricant reduces friction and protects sensitive tissues from tearing. Communicate with your partner. If you feel pressured to rush or perform before you're ready, say something. Intimacy should never come at the cost of your health or comfort. If you're using ED medications, allow them time to fully activate. These medications are designed to help increase blood flow, but they're not instant solutions. Don't be in a hurry. Be intentional. Let me share a story. A 68-year-old man once came to my office with a downward bend in his erection and a look of quiet shame. He told me, "I thought it was normal to have changes at my age." But after we talked, he realized that the changes began when he started skipping foreplay and rushing intimacy with a new partner, mostly because he didn't want to seem old. He wasn't old. He was uninformed. And when we corrected that, he didn't just regain control, he reclaimed his confidence. Because here's the truth, taking your time isn't weakness. It's wisdom. It's knowing that your body deserves care, that pleasure is better when it's pain-free, and that you still have the power to choose what's right for you. Your penis is not a tool to be forced into action. It's an organ of sensitivity, connection, and dignity. And protecting it means slowing down, listening to your body, and refusing to sacrifice long-term function for short-term anxiety. This one small habit, waiting until you're fully erect before intimacy, can spare you years of discomfort, medical intervention, and emotional distress. It's not about being fragile. It's about being smart. It's about being respected. And most importantly, it's about being seen. 4. Limit porn. Maximize real connection. Let's have an honest conversation, man to man. In the privacy of your room, after the lights are out and the world grows quiet, many older men turn to one of the most accessible outlets for release and stimulation, pornography. And at first, it seems like no big deal. It's private. It's familiar. It seems harmless. But after decades of listening to men over 60, I've seen what most don't recognize until it's too late. What begins as an occasional escape often becomes a silent habit. And it doesn't just affect your body, it begins to retrain your brain. You see, your brain is the most powerful sexual organ you have. Every image, every fantasy, every rush of dopamine during stimulation rewires the pathways of arousal. And when you rely too heavily on fast-paced, intense visual stimulation from porn, your brain stops responding to real life in the same way. Here's the truth most men don't know. Overexposure to pornography desensitizes the brain. The result? Real touch doesn't feel the same. Emotional connection doesn't excite you like it used to. And before you know it, your desire is high, but your performance is low. You might be wondering, why do I still want it, but my body won't respond when I'm with my partner? The answer may not lie in your testosterone or your age, but in your habits. I've treated married men who confessed through tears that porn had become their only outlet, not because they didn't love their wives, but because their minds had been rewired. They had trained themselves to respond only to isolated, impersonal stimulation, not emotional closeness or tender touch. This isn't about shame. It's not about guilt. It's about awareness. The more time you spend in artificial stimulation, the more distant you become from real human connection. And over time, it doesn't just impact performance, it begins to erode confidence, self-worth, and the very thing that makes intimacy meaningful, presence. So, what can you do? Moderate your consumption. You don't have to quit cold turkey overnight, but begin to replace the screen with memories, imagination, and emotional connection. Focus on real stimulation. If you're partnered, invest time in communication, affection, and unrushed intimacy. If you're single, explore sensual self-touch without relying on visual triggers. Retrain your arousal pathways. This might mean slowing down your routine, introducing mindfulness practices, or even journaling about your emotions before or after arousal. Reconnection starts in the brain. Remember, your worth is not measured by performance. You're not less of a man if you're struggling. You're more of a man for facing it with honesty. Desire doesn't disappear with age, but how we experience it must evolve. When you limit your dependency on porn, you allow your mind to reconnect with your body. You create space for emotional closeness, spontaneity, and authentic pleasure. And you remind yourself that real intimacy isn't found in pixels. It's found in touch, trust, and being truly seen. Gentlemen, you deserve more than a lonely release. You deserve connection. You deserve freedom from shame. You deserve to feel fully alive. Number 5. Prioritize lifestyle over pills. the true prescription for lifelong vitality. Let me share something that may surprise you, something I've learned from 3 decades of working with older men. It's not the pills that save your health, it's your daily choices. I've seen men in their late 60s and 70s walk into my clinic with a list of medications in one hand and a heavy heart in the other. They're tired, frustrated, sometimes embarrassed. They've been told that to fix their body, they just need a stronger pill, a higher dose, a newer drug. But when I sit down with them, look them in the eye, and ask them, tell me about your lifestyle, that's when the real conversation begins. Because sexual health isn't just about blood flow, it's about your entire system, your heart, your circulation, your diet, your sleep, your stress levels, even your relationships. You see, the penis isn't an isolated organ. It's a reflection of what's going on inside your body. And here's what I want you to hear loud and clear: erectile dysfunction is often the first early warning sign of heart disease. That's not a scare tactic, that's science. When blood isn't flowing freely through your arteries, whether to your heart, your brain, or your penis, your body is signaling that something deeper is wrong. So before you ask for another prescription, I urge you to ask yourself, am I moving my body every day? Am I feeding myself foods that nourish or deplete me? Am I sleeping enough? Am I managing stress or drowning in it? Here's the good news: every healthy choice you make now will pay off almost immediately. Quit smoking, and you'll see better blood flow within days. Cut back on alcohol, and your hormones will begin to rebalance. Add 30 minutes of walking each day, and you'll improve cardiovascular function and boost testosterone. Eat more leafy greens, fatty fish, berries, and nuts, and you'll support circulation, reduce inflammation, and regain energy. And the result? Stronger erections, sharper mental focus, more confidence in your own skin, greater connection with your partner, and a sense of control. I've seen men turn their entire lives around, not by adding another drug, but by returning to the basics: movement, nutrition, sleep, hydration, and connection. And do you know what's even more powerful than the results? The sense of agency. That moment when a man realizes, I'm not broken. I'm responsive, and I can rebuild. There is no medication on earth more potent than the belief that you can heal yourself through how you live. So, here's my challenge to you: start small. Choose one habit today that your future self will thank you for. Replace one drink with water. Take a short walk. Choose whole foods over processed foods. Go to bed 30 minutes earlier. Because these choices aren't just about your penis, they're about your life, your laughter, your pride, your intimacy, and your peace of mind. You are not powerless. You are in control. And if you're still with me, I have one final tip, one that almost no one talks about, but could make a massive difference to your sexual health, your comfort, and your long-term confidence. Let's discuss something so simple it might surprise you, but I promise it's worth your attention. Ready for the bonus tip? Let's go. Bonus tip: sleep without underwear. The nighttime habit that can preserve your manhood. You might be thinking, really, Dr. Grant? What does underwear have to do with my health? Let me explain. For decades, we've been taught to wear certain clothes, follow certain routines, and rarely question the impact of small daily habits on our health. But over the years, I've discovered something simple, almost too simple, that has helped dozens of my patients restore comfort, improve circulation, and even prevent one of the most painful conditions affecting older men: Peyronie's disease, a condition marked by painful curvature of the penis caused by internal scarring. One of the hidden culprits? Tight or restrictive underwear during sleep. Here's the science. At night, your body isn't just resting, it's healing. In fact, healthy men experience several spontaneous erections during REM sleep. These nighttime erections are completely normal and essential for maintaining blood flow and tissue elasticity in the penis. But if you wear tight briefs or constrictive sleepwear, especially as your body naturally tries to expand during these moments, you're putting constant pressure on delicate tissues. Over time, this can lead to micro-injuries, restricted blood flow, irritation and discomfort, and eventually fibrous scarring inside the shaft. So, what's the fix? Let it breathe. Sleep without underwear, or choose soft, loose-fitting boxers that don't compress or restrict. This simple switch allows your body to regulate temperature, maintain natural blood flow, and support nighttime healing without interference. You'd be amazed how many men return a month or two later and say things like, "Dr. Grant, I sleep better. I feel more comfortable. Even my morning energy is better." Why? Because the body responds beautifully when you stop getting in its way. Your skin can breathe, your tissues can stretch, your nerves can relax, and most importantly, you wake up feeling connected to your body, not compressed by it. So tonight, I invite you to try it. Slip under the covers with nothing but your skin. Let your body rest in its natural state, and give yourself the gift of freedom one night at a time. This habit may be small, but it represents something far greater, a mindset of caring for your body, not with force, but with attention, a practice of comfort, dignity, and ownership over how you treat yourself, a reminder that aging doesn't mean restricting, it means adapting. And now that we've covered the full spectrum of physical care, from sexual activity to hygiene, from emotional connection to lifestyle habits, and now to sleep, let me close with a few final words just for you. Because this isn't just about anatomy, it's about something deeper. Let's talk about what it really means to age with dignity and why your story is far from over. Aging with dignity, connection, and confidence. I want to leave you with something that goes beyond the science, beyond the routines, even beyond the 5 essential steps we've discussed. Because while I've given you strategies to improve your physical health, this journey is really about something greater. It's about owning your story. Too often, older men are told, directly or indirectly, that their value fades with age, that their sexuality is irrelevant, that their confidence, vitality, or need for intimacy is no longer important. That is a dangerous lie. And I'm here to tell you the opposite. You are not invisible. You are not broken. You are not finished. Your body is not a machine that deteriorates with time. It's a living system, always ready to respond to care, attention, and love. Even in your 60s, 70s, or 80s, you can still feel, heal, and grow. The steps we've explored together, staying sexually active, maintaining hygiene, avoiding injury, limiting overstimulation, building a healthy lifestyle, and even sleeping without underwear, are not just about improving erections. They're about preserving your dignity. They're about waking up in the morning and feeling whole in your body. They're about walking into a room without shrinking because you know your worth. They're about facing the mirror and seeing not what's been lost, but what still remains, your strength, your wisdom, your ability to love and be loved. I've worked with countless men over the years, men who came unashamed, defeated, and afraid they were past their prime. And I watched as they reclaimed themselves, not because of surgery or prescriptions, but because they chose to show up for themselves every single day. So now I'm asking you, what step will you take today? Will you start walking 30 minutes a day? Will you clean with more care and awareness? Will you have that conversation with your partner you've been putting off? Will you try sleeping more freely tonight just to see how it feels? Whatever it is, start with one thing and build from there. If this message touched you, I'd love to hear from you in the comments. Tell me what resonated most. What are you working on in your journey? What questions do you still have? We are building a community here, a place where men over 60 can talk openly, heal fully, and grow confidently. And if this video gave you insight, courage, or hope, please like, subscribe, and share it with a brother, friend, or father who may need it. Because every man deserves to feel alive, seen, and strong in his own skin. Thank you for spending this time with me. I'm Dr. Harold Grant, and I'm honored to walk this path with you. Until next time, stay strong, stay kind to yourself, and never stop claiming your vitality.